from your backyard with our routine Monday COVID-19 quarantine update with our friend and health advisor, Dr. Susan Lovelle. Thank you for joining us again, Dr. Lovelle.
Thank you, Robert.
So I'm just going to let you go right into the update.
Okay. So, I think a lot of people are concerned, thinking all about the states that are opening, the areas that are opening. And the point of it is that at this point, all we can do is wait and just see what happens. It's a 2 to 14-day incubation period. And so the fact that sometimes the incident rates, which is how many cases per 100,000 of population, when those rates kind of go up or down, we don't know whether or not it's really, if it's like a daily thing, if it's really that the incident rate is going up or just that we had more testing that day or whatever it is. So we really need to look at the next 2 weeks, and that will tell the story. So that's really all I've got on that one. The fact that we just are going to have to wait and see what happens.
So it's the numbers plus our own judgment, right? We see the numbers going down in 2 weeks. We may personally want to wait another week or 6. It just depends on our on our comfort level.
Exactly. So essentially what I did want to talk about today, though, was us being proactive, and proactive in the sense of protecting ourselves. And I don't mean, washing our hands and wearing our face masks, but what are we going to do to boost our immune system, to bolster our own health? And there have been more and more studies that maybe some of the mechanisms of what we thought this particular coronavirus, the way it's attacking, is not so much working against our lungs, but actually causing oxidative stress.
Oh yeah, oxidative. I see that now. But for those who don't know, would you please illuminate?
Yes. So essentially, what it is our body. Let's put it in a different way. Our body can manage a certain amount of toxicity, and that's from the outside. It could be pesticides. It could be the stuff we're putting on. It could be the air we breathe. It could be mold. It could be from the inside. So medications we're taking, bacteria, viruses, everything. There's all of this that goes into one big bucket of what we call toxicity.
Right.
And our body, we put toxins in, and our body gets rid of them.
Right.
So when it gets to the point where that bucket's getting filled faster than we can empty it, then our whole system gets overrun. And one of the things that suffers is our immunity. So if we want to help our immunity, we want to make sure that we're clearing our toxins as much as we possibly can.
So if it's attacking our immunity, then that automatically is going to fall to our weakest thing. If we already have a pre-existing condition without immunity, that's probably the one that it's going to attack first or affect the most.
Absolutely. See, you know it. You got it.
Thank you. So how do we continue to
How do we keep ourselves going? So the first thing is to avoid the things that are very toxic. So things like, if you're living in a moldy home, see what you can do to clear the mold. Use an air filter, use a water filter. Have whatever's coming into you be as clean and as non-toxic as possible. Right. And then for other things would be from the inside. So making sure that your gut health is as strong as possible. Why your gut? Your gut is 70% of your immune system. And I think I've mentioned that before. So you want to make sure that that's good. We don't like to talk about it, but make sure that your bowel habits are good, because that's where a lot of toxins go. Saunas are wonderful because it's going to steam the skin and get toxins out through the skin. Making sure that you're taking a good probiotic, not just any, but a good probiotic, and make sure that the bacteria that you have in your gut are really healthy. So these are just some of the things that we can do. Exercise.
Exercise, right. I see a lot of these products like a foot pad that is supposed to remove toxins, and I've always been dubious if that's really, do we need to go to that extreme? Or even those available? Do you understand the question?
There are some real toxin binders And
Yes,
so it
ma'am.
would be something that you would take orally. One of them is activated charcoal. Sounds really crazy, but you think about it. If you go to the, if somehow you've gotten some poison, you go to the emergency room, they're going to give you charcoal because it works wonderfully. It
Right.
just
It
binds up
binds with everything.
and pulls everything out.
Right.
The main thing with something like that is you want to make sure that you're taking enough water, because if you bind it and it doesn't get out, then guess what? It's just sitting there and it
Right.
recirculates again.
You brought it all into one spot now.
Exactly,
Yeah.
exactly. So yes, there are real binders that they really do work. You just have to make sure that you're really flushing the same thing.
Okay. Anything else specifically toward the immune system that you wanted
Uh,
to bring up?
and then just making sure that you're eating an anti-inflammatory diet. So I think I had mentioned not having too much of the comfort foods.
Right.
Really just kind of taking good care of yourself, and meditation. That's another thing. So detoxing the mind as well
Right.
as the body.
Well, can you speak toward, I've heard of this medicine that's supposed to have some influence on the coronavirus, rumdividol. I'm sorry. You know what I'm talking
Yes,
about?
I do, remdesivir.
Okay.
So that actually is an antiviral, and it's not a new one. It was actually developed quite a while ago. It was
Oh,
developed with hope of treating Ebola and hepatitis, and it
oh,
didn't really work well with either one of them. But what it does is it does work against the RNA, the brain of the virus,
right,
and it will keep it from replicating. So, what it's being used for now, the studies are being used for, are people who, number one, already have the disease, and
okay,
number two, have a severe case of it. So, instead of, say, being in the hospital 15 days, you might be in the hospital 11 days. So, it's cutting things down. It's not
okay.
not a vaccine, not a cure, it's a treatment.
It's
And
a
really,
treatment,
it's a
and
treatment
that's all it is for certain
at this
patients.
point, right? For
Okay.
certain patients.
Are there any drugs that are looking more positive, or is that the one drug we have at this point in
There
our?
are some other antivirals, also the antimalarials, and that will take us down a whole nother avenue, because of what looking at one of the actual ways that the virus is causing injury, and
Mm,
looking at not so much injuring the lungs per se, the alveoli, the little air sacs,
right,
but if you can imagine that once the oxygen gets to the air sac, it needs a little boat to take that oxygen to all of the tissues.
right.
And so what they're now thinking is that maybe the damage is those little boats that are getting around. So the
Ah,
oxygen, which would be why the ventilators are not working as well as we would think that they should, if it's
right,
all in the lungs. Yeah.
right. It's an internal physical mechanism
It-
versus just getting oxygen to
to the
the.
lungs. Exactly. Exactly.
Um, so it seems to me vaccine then is going to be one of our best hopes for getting really back to full normal. Is that correct?
Most likely,
Okay.
just because we talked about herd mentality at one point, where enough people have it that and have recovered, that there's some safety. The other would be the vaccine. The thing with vaccines is that they are not developed quickly.
Right.
The vaccine we take this year for the flu was last year's flu. It takes a
Right.
while to develop a vaccine.
All right. Well, let me ask. So when I was growing up, I remember the vaccines reel, the film, and it had these eggs come in, and the needle put it in the egg, and then the egg went off to incubate, and then your vaccine grew. Is that still the modern method, or have we gotten away from eggs and into?
There is still eggs in many vaccines. Yes, there
Okay.
are some egg-free forms, but there is still egg in quite a few. Yeah.
All right. So vaccines just take time because it takes time to grow it and replicate it and make it
Exactly. Exactly.
harmless and helpful and not harmful and deadly. Right?
Exactly. Exactly.
Um,
hmm
So, any idea on the numbers? Are you seeing our trend start to come down, or are we still,
We're still in that bumpy kind of up and down thing. Here in the Raleigh Durham area, we had a significant spike a couple of days ago. And then we went low. So, like I said, we don't know whether that's just the fact that there was more testing done that day or whether really something happened. We just don't know. And the only way we'll know is if we follow this out for a couple of weeks.
then I'm saying to a large degree, this May 8th reopen date is somewhat arbitrary and not numbers oriented, but maybe frustration and economic oriented.
Yes.
Do you agree to that to any bit, or is that just me?
Well, no, I mean, I think that's what it is at this point. If the recommendations was to see a trend for, at least a week of downward spiraling, we're not seeing that anywhere. So the fact that we're opening just means that people have gotten frustrated, and we're gonna kind of gonna go with it. So that's why I'm saying make sure that whatever you decide to do, whether it's stay home or go out, that you're doing the best that you possibly can to take care of yourself.
Um, well, how are you doing right now in this time, Dr. Lovelle? I imagine your phone is ringing off the hook. Are you still hanging in there?
I'm doing really well, hanging in there, and really just helping people in my community, not just my practice members, but just getting on social media like this, giving information, helping whoever calls, because that's the most important thing at this point.
Well, you've done a great job of disseminating information. If y'all haven't been to Dr. Lavelle's Facebook page, definitely check it out. She's got every week or so, if not 4 or 5 times a week, you're posting new stuff.
Yeah.
And
Yes.
Premier Wellness with Dr. Lovelle. So, is it okay to give your number out?
Oh, absolutely.
Would you share that with us real quick?
Yes, it's 919-925-5910.
Well, Dr. Lovelle, you've been a great comfort to me and Jonathan here at YBY. We really do appreciate you sharing your time.
Thank you.
You've also been busy introducing us to other wellness professionals so that we can help get the word out, and we really appreciate that. So,
Absolutely.
um, of lately, we've been to Raleigh, Cary, Durham, and Chapel Hill. So the whole triangle. Let me remind you the power of local wellness is having a wellness professional like Dr. Lovelle spending the time it takes to do a proper diagnosis and make sure that you get exactly what you need. So
Thank you.
reach out to her. All this and more is right here in your backyard. Thank you, Raleigh. Thank you, Dr. Lovelle.
Bye-bye.